now the breast cancer is a leading one.
So just a tablet for breast cancer.
1 in 9 women will have the breast cancer in her lifetime.
Many people are scared of mammography.
सारे के सारे lump breast के अंदर cancerous नहीं है. Sometimes the cancer does not arise in the breast but directly in the underarm.
If a woman in her reproductive age gets breast cancer, then can she reproduce?
She had a breast lump for almost 14 months. Breast cancer more in the younger women nowadays. And these patients are now living a totally normal life.
If somebody's mother has breast cancer, only the daughter should get screened or even the son should get screened?
उनको तो 2 कीमो मिला था, 4 कीमो मिला था, मेरे को तो इतना सारा मिल गया. The little girl said to me, here is a doctor who saved my mom.
A cancer is detected. Is there any hope or there's no hope? They lose all the hope. Hello everyone and a very warm welcome to the podcast. Today we are going to talk about something that is affecting millions of women around the world, but is still not discussed openly enough: breast health and breast cancer. Most of us have heard about breast cancer, but still there are many questions around it. What are the symptoms to look out for? Does every lump mean a cancer? What role does mammography play? When should a woman get screened? With the newer advancements coming in, will we be able to detect the problems earlier? To help us understand all of this, we have with us today one of the leading oncologists, head of the Department of Medical Oncology from Manipal Hospital's Dwarka, Delhi, Dr. Manish Sharma. He has an extensive experience in treating all the cancer types. Hello, sir, and welcome to the podcast.
Thank you so much. I'm glad I'm here for this important topic, which you rightly mentioned that many of the women are experiencing these issues in the breast cancer, and what to do next, they don't know about that.
Exactly, sir. Sir, as you've just now told that it is affecting a lot of people, then why do you think still women are ignoring their breast health, and why breast health awareness is an important part even if they do not have any symptoms?
So I think the women in India especially, not in India, across the world, they keep their health at last. So I think they are the symbol of sacrifice most of the time. So they have the time for all, their children, their family, but not for them. And even if they detect they have the symptoms, they sometimes ignore that. Or they sometimes feel shy about that, sometimes hide that because of the embarrassment sometimes they may feel. So even if they detect it, they don't come up early. And there are many stories around that.
True that. How common is breast cancer in India compared to the Western countries?
So see, the breast cancer is the most common cancer in the world and in India as well. So there were the days when the cervical cancer was most common cancer in the women, but now because of the westernization and because of some lifestyle issues, I think the breast cancer has become most common cancer, because of which the breast cancer is now a leading cause of cancer amongst the women in India. And if you talk about the numbers, 1 in 9 women will have the breast cancer in her lifetime. So this is a whopping number. Every woman should be aware about that, because if they are aware that this is the number that the breast cancer can affect them, then probably they will come early for the screening and the treatment also.
I can totally relate, yes. 1 in 9 is really a concerning number, and every woman should be aware of it.
Right, true.
Doctor, what are the risk factors for developing breast cancer?
So there are many risk factors for the breast cancer. Importantly is the being a woman. So mainly the being a woman is very important risk factor for breast cancer. It doesn't mean that males cannot have. Males can have, but they're extremely rare to have a breast cancer in the male population. Then second, age. So as we age, the cancer tends to develop. But going by that doesn't mean that younger population cannot have the breast cancer. Then obesity, lack of physical activity, because of them there are hormones in the body that can lead to the breast cancer. Then early menarche and late menopause, they are the risk factors for breast cancer. And then those ladies who tend to not breastfeed, who decide not to breastfeed a baby. So breastfeeding a baby is a preventive, of somewhat preventive in the breast cancer. So these people, they tend to have increased risk of breast cancer. Apart from that, smoking, alcohol consumption, they are very, very important risk factor of breast cancer in women.
As you have told that being a woman, unfortunately, is one of the risk factors. So, what can we do as preventive measures to prevent the cancer?
So we can divide this answer into two parts. So one are those risk factors which are modifiable, and others are those risk factors which are non-modifiable. So modifiable risk factors are those which happens because of our lifestyle. So as I said, that the westernized lifestyle or alcohol or smoking, they're important risk factors. So these are modifiable risk factors. Like you can modify the risk for the obesity, then increase the physical activity. Weight gain should be curtailed and leading a healthy lifestyle. So these are the modifiable risk factors. There are certain non-modifiable risk factors like the genetics, what we get from our family members. So certain people, they can have high risk genetics like BRCA1 mutation, as I said, and these BRCA mutations are usually non-modifiable. And if someone is carrying these non-modifiable mutations, then the best thing is to get the consultation with the doctor, a genetic counselor, and some screening and some kind of surgeries they are available to prevent breast cancer in these patients.
That's a great news. So, coming to the symptoms of breast cancer, what are the major symptoms that we should be looking out for?
So important thing is to have self-image. So if I know how the breast looks like, so what is right for me, then I would be able to pick up what is the difference which is happening because of the difference. So breast self-examination is very, very important. And if you talk about the symptoms, so knowing the one self-image is very, very important. And any lump which has appeared recently, either in the breast or in the armpit, that is axilla, is something to be concerned about. Then similarly, the changes in the skin, like orange peel appearance of the breast, it is a concerning fact. It should be looked for. And any discharge from the nipple, especially the bloody discharge from the nipple, then the inversion of the nipple or any shape change that has happened recently and that was not present previously. So these all are the symptoms which one should look upon. And importantly, it is important to know that the breast cancer, they're usually painless in the early stages. So most of the women, they will have the breast cancer which is painless, and still they ignore the symptoms because it is just a painless lump and not the painful lump.
So, as you rightly said, most of them are painless. So, if there is any lump and it's painless, is it a serious concern?
So see, if there is a lump, just get it checked by the doctor. Just don't get worried about that or get anxious about that, because if you have the disease, then it will be treated, and if you don't have the one, then you are assured that this is not a disease. So practically, this is not a uniform rule, but you see the younger population will have a different kind of cystic diseases or different kind of hormone related lumps in the breast that are usually normal to have. So this depends upon the scenario, the clinical features, age, risk factors. There are certain lump would be a cancerous lump and certain lump would be just a benign lump. So get the lump checked, because all lumps are not cancerous. They can be benign depending upon the age and the clinical scenario.
Sir, अभी आपने mention किया cystic diseases. For our audience to know, cystic क्या चीज होती है? Cystic diseases.
So cystic disease, there is a term which we call as cystic disease, fibrocystic disease. Usually the fibrocystic diseases होती हैं, ये younger women में होती हैं, young women में, because of the hormonal changes होती हैं, and they produce a lump which is a benign lump. So what is the difference between a cancer and a benign lump? So cancer is something which is growing continuously and it not stopping. And benign lump is something which produces a mass and then it stops and sometimes get regressed and it does not progress. So these are two kind of lump which we find in the breast. The fibrocystic disease is a disease which is totally benign and it happens because of the hormonal manipulations in the breast. Usually happens in the younger population, younger ages, not in the older population. So even if someone has the cystic disease, benign cystic disease, which is not the cancer, just get it checked by the physician.
So तो benign मतलब non-cancerous.
Benign का मतलब होता है नॉन कैंसरस. सो सारे के सारे लम्ब ब्रेस्ट के अंदर कैंसरस नहीं हो, ये अच्छी न्यूज है.
हम अपने ऑडियंस को ये कह सकते हैं कि कोई भी लंप अगर है तो दे शुड नॉट बी स्केयर्ड.
सो स्केयर्ड होने की जरूरत नहीं है, बट चेकअप करने की बहुत जरूरत में. आप ये डिसीजन नहीं ले सकते हैं कि ये कैंसर है या बेनाइन लम्प है. ये दिस हैज टू बी चेक्ड बाय द डॉक्टर.
तो कोई भी लंप मिले डॉक्टर पे जाएं.
बिल्कुल.
एंड स्टे अवेयर ऑफ योर बॉडी.
यस, स्टेइंग अवेयर ऑफ द वंस बॉडी इज वेरी इंपॉर्टेंट.
सर जैसे कि आपने मेंशन किया था सेल्फ ब्रेस्ट एग्जामिनेशन, आपके अकॉर्डिंग सेल्फ ब्रेस्ट एग्जामिनेशन कितना इंपॉर्टेंट है एक वुमेन के लिए?
So breast self-examination is very important, extremely important. So I will get to that how we should do and why it is important. Because the screening is one which happens in the clinic. Person has to go once a year with the help of mammography and all. But breast self-examination is the thing that one can perform during the shower once a month and after the periods are over. So this is the best time that the breast self-examination should be done. One should be aware of what and how the breasts are. And if they found any problem or any changes in the breast, it should be immediately reported to the doctor.
When after the periods?
Fix a time. Mostly once the periods have stopped and after 1 week of the stopping of the period is the best time.
Okay. So what if anybody is doing it regularly?
No, so it should not be done regularly. It should be done once a month.
Sir, can you please explain in a clear way and a simpler way कि self breast examination कैसे करनी चाहिए?
So breast self-examination should be done once a month, and mostly is the best time to do it once the person is taking a shower and 1 week after the periods they have stopped. So starting from the nipple, all the quadrants of the breast should be palpated in a circular manner, and the underarms should also be palpated. Because sometimes what happens, the cancer does not arise in the breast, but directly in the underarms. So if any lady, any woman has a lump in the underarm, not in the breast, then also it can be a breast cancer. So this is how it should be done.
सही, आपने बहुत इम्पोर्टेंट पॉइंट बताया है जो आई थिंक मेनी ऑफ द वुमेन डोंट नो.
राइट. अंडर आर्म में कभी भी अगर लंप है, लिम्फेडिनोपैथी है, लिम्फ नोड्स अगर अंडर आर्म के बड़े हुए हैं, कई बार फिजिशियंस, डॉक्टर्स और पेशेंट्स भी सोचते हैं कि शायद ये इन्फेक्शन के कारण हो गए. बट इन अ लेडी इफ अंडर आर्म में कोई भी स्वेलिंग है तो इट शुड नॉट बी जस्ट said as a non-cancerous or just a tuberculosis or just a infection. It can be cancer, so it should be looked for.
So that's a great point. So moving on to the screening part. If a woman comes to you that she self-diagnosed or self-examined and there is a lump and she comes running saying, "Sir, is it breast cancer?" What would be the next move?
Okay. So these are two different scenarios. So the one you mentioned is that women has a lump and she is coming for a screening. So probably she is already having a disease. So this is not a screening part. So now it has to be diagnosed whether it is cancerous or non-cancerous. So let me make it very clear to our audience that screening का मतलब होता है जैसे हमारी गाड़ी खराब नहीं होती है लेकिन फिर भी हम लोग उसको गैराज में लेके जाते हैं, चेक करवाते हैं कि सब कुछ ठीक है या नहीं. इसी तरीके से जब हमारे को कोई इलनेस नहीं है, कोई बीमारी नहीं है, और तब हम कुछ टेस्ट करते हैं, तो that is called as screening. So once a woman comes and she doesn't have a lump and she is just undergoing the testing, that is a part of the screening. This is a part of the primary prevention. But if someone has a lump, so this is not a screening. So this now has to be diagnosed whether it is a benign lump or a cancerous lump. So screening की जब बात करते हैं तो मोस्टली स्क्रीनिंग के रिकमेंडेशंस में 50 इयर्स के बियॉन्ड जो भी पॉपुलेशन है, फीमेल पॉपुलेशन, they should undergo a X-ray mammography of the breast. So what is the advantage? X-ray mammography has got an advantage that the breast lumps which are detected on the regular screening, they are very small. And if the breast cancer is detected in the early stages, then the survival is better. The treatment which is needed to cure the cancer is less, and the treatment is less brutal as compared to what if the lump is not a screen detected lump, or if the person comes in, say, stage 3 or stage 4. So this is the importance of the screening.
So how do we do a mammography?
So mammography is done by the special machines nowadays, and it's called a digital mammography, which is the best thing where the person should undergo a mammography, but it has got some limitations also. So I tell you that the younger women, younger ladies who want to undergo screening for some particular reason, so although it is not indicated to do this screening or X-ray mammography in the younger population as a part of screening, but because the younger women, they tend to have a denser breast, and what you are looking at the mammography are the microcalcifications. So microcalcifications are very well picked up on the X-ray mammography, but some younger ladies, they can have some denser breast, and because of which the small cancer can hide behind those, and hence the X-ray mammography would not be a good tool to do mammography screening in these ladies. So younger women should ideally undergo a sonomammogram. So it should be a combination of ultrasound of the breast and the X-ray mammography,
That's a good point, so to be noted.
because it can sometimes lead to false negative results, and it can give you the false negative assurance that there is no cancer. So we have to be aware about that.
Okay. So as you just now mentioned, microcalcifications, what are those, just for our
So
audience?
whenever the tumor happens, so cancer happens, there is some peculiar calcification that happens in those tumorous area. So there are different kind of patterns that happen, and these are picked up by. So these are pretty technical terms, pretty looked by the radiologist under the on the screen, and then they can tell whether this is a benign microcalcification or a cancerous microcalcification.
Many people are scared of mammography if it is painful, or they have a misconception that mammography can lead to breast cancer. Is it true?
So this is not true. Mammography doesn't lead to the breast cancer. So modern radiology machines which are used for mammography nowadays, the radiation exposure to the breast is extremely low. So various studies have found that the exposure of radiation, what happens with the mammography in the screening mammography part, does not lead to the breast cancer. And second part, you're right. It is somewhat a painful process, but no pain, no gain. So if you have some pain, then probably you can prevent a longer painful treatment process that can happen if the breast cancer goes undetected.
Exactly. So we can catch it early, treat it early, rather than just waiting and worrying.
Yeah, so don't worry and don't just wait. Go for the screening part, because so if you see the statistics around the world and even in India, the early you go to the doctor with a smaller disease, the treatment is less painful, less brutal, and the cure rates are extremely good. So now we have many of our patients who say are living a very good and healthy life. They're cured of the cancer just because they came in the earlier stages. So one of the story that touched me. So there was a lady 2 hours from the city, so a nearby town, and she had a breast lump for almost 14 months. So she was a teacher, well educated, and still waited for 14 months before coming to us. So I inquired about that sign and symptoms. So she told that I noticed a lump 14 months back, and then I became busy in my school where there was a function in the school, and then there was a function in the family. Then she had a daughter who was getting married, and somehow she came to us after 1.5 years. So what was wrong there? She was educated. She had a mobile phone. She was well aware that this can be a cancer. Then she had insurance also, but she came to us very late. So so what could have been just a small surgery at that time with some smaller treatment now changed the entire thing. So now she had to undergo whole breast removal. So which could not have been avoided in that case. So particularly she could have undergone just a small surgery, just a radiation, and then the treatment was over. But now she had to undergo full surgical procedure. The breast was removed, the radiation was done, chemotherapy was done. Although she is now okay, so 4 years down the line she is okay, but see the brutalness of the treatment which has happened to her just because she came late to us.
The journey became difficult.
Journey became difficult, definitely.
So we should all get screened.
We should get screened.
And sir, the right age, if you can tell our audience, to start the screening.
So right age, as per the guidelines, is around 45 to 50 years. So in India, we are finding that many of the younger women are also getting cancer. So exact age for screening is 45 years and beyond. Every year, mammography should be done. But if someone has a family history or genetic disorder like the BRCA mutations, these women should undergo screening earlier. So they should consult the physician and ask for what and how should the screening be done. So just for example, if someone in the family has a breast cancer, so say mother has a breast cancer, then the daughter should start screening 10 years before the age the mother had a cancer.
Okay, so citing an example, if the mother had the breast cancer at the age of 48,
then the lady should start at 38.
38.
Right.
Correct. And so, since we are talking about family history, can you please elaborate on this?
So there is a myth around that if my family does not have a cancer, I will not have a cancer. So this is not true. So family history is definitely important, but having no family history doesn't mean that I am immune to the cancer, right? So family history, if there is a family history of breast cancer or ovarian cancer, then there is a slightly higher risk of getting breast cancer. But if family history is not there, then it doesn't mean that I cannot have breast cancer. So number one. Number two, there are few mutations. So around 10% of the patients, they will have some genetic mutations like BRCA1 and BRCA2. So these mutations are extremely common in these patients who have family history. And those patients who have these kind of mutations, they have the advantage that there is a targeted therapy which is there, which we can utilize for them. And if they have this mutation, they should get their family screened for this mutation. And when the family has this BRCA mutation, then the regular screening should be done for these patients.
So if somebody's mother has breast cancer, only the daughter should get screened or even the son should get screened?
No, see, if there is a family history of breast cancer, the daughter should definitely get screened. So males can also have breast cancer. So this might be a news for some of the audience, but males can also get breast cancer. But usually males getting the breast cancer is not very common. And there is a specific mutation that I just spoke about, that is BRCA mutation. So the carrier of these mutation, if the male is a carrier of this mutation, then he can have breast cancer, pancreatic cancer, prostate cancer, or GI cancers. So there are some specific groups where the male can also have breast cancer.
So we should tell it to all our men as well that they should also be aware.
They should also be aware that the breast cancer can affect males as well.
Thank you so much, sir, for such an important point. So now moving on to the treatment of the breast cancer. So if a lady is coming to you with a lump, how does the treatment process start?
So let's divide the treatment process into the diagnostic part and then the treatment part. So diagnostic part is very, very important. So once a lady comes to us with a lump, then we would like to diagnose whether it's a benign lump, non-cancerous lump, or a cancerous lump. So cancerous lumps, so in a layman language, cancerous lumps are those for which we are worried about. We are not worried about the benign lumps or which are non-cancerous, because these benign lumps, they don't progress, but the cancer lump, they progress and they need treatment. So doing a biopsy which would establish that this is a cancerous lump is number one. And there is a myth around the biopsy that it can spread the cancer. I think this myth should be busted by our podcast, because biopsy is very, very important. Until and unless we do biopsy, we are not able to diagnose the breast cancer. Once the biopsy is done, it is diagnosed, then we would like to stage the cancer. So staging process means that whether the tumor is just limited to the breast or it has now moved to the lymph nodes, that is the armpit, or it has moved beyond it, which in case it would become a stage 4 tumor. So diagnosing with the help of biopsy, and then secondly staging with the help of, say, PET CT scan or MRI or CT scans.
So biopsy is totally safe.
Biopsy is safe and it doesn't lead to the risk of seeding. It must be done.
Point to be noted for all the audience.
Yeah.
And so coming to the surgery part, if a woman is scared of the breast removal, so the entire breast removed during the surgery?
So treatment, so we divide treatment into three parts. One is surgical, other is radiation, and the third is the systemic therapy. Systemic therapy means the chemotherapy part and the hormonal therapy part, immunotherapies and targeted therapies, which are now newer in this treatment. So coming on to the surgery part, these surgeries are not mutilating as before nowadays. So if I talk about 20 years back, the surgeries were more mutilating. But nowadays, the surgeries, they are less mutilating. And most of the time, we are going towards the breast conservation. Breast conservation means that we just remove a lump and then give the radiation to the breast, and the breasts are conserved. Because this is even so more important, because we are seeing breast cancer more in the younger women nowadays, and removing whole breast is very, very mutilating. So the surgical part has progressed a lot. We tried to remove the lump and not the whole breast, but there is a catch here. The cancer should be at the early stages. If the woman is coming at the later stages, the salvaging the breast becomes a problem in these patients. So this is about the surgical part. But if there is a progression and the cancer has now progressed to the later stages, most of the women will get the whole of the breast removed, and hence comes the importance of early detection and screening.
So if it's detected early, we can save the breast tissues.
True.
So what is the entire treatment process? Like, is it individualized to each person, or there's a common plan for all the women?
So see, the treatment has revolutionized. Now, the term which we use for the treatment in the breast cancer is the personalized treatment or the precision medicine. What is a term to be accurate? So personalized treatment means that one breast cancer is not like the other's breast cancer.
Oh.
So we have patients in the clinic who come to us and they say कि उनको तो 2 कीमो मिला था, 4 कीमो मिला था, मेरे को तो इतना सारा मिल गया, और उनको तो कीमो मिला ही नहीं, मेरे को बिना कीमो के आप ट्रीटमेंट कैसे करोगे, आप बताओ. So but this is not right, because once we classify the breast cancer of the one patient will not be equal to the breast cancer of the other. One size does not fit all.
Exactly.
So some patient can get away with just surgery, radiation and a hormonal therapy without ever going to the targeted therapies or immunotherapies or chemotherapies. And other patient, even in the early stages, may need surgery, radiation, immunotherapy and chemotherapy and the targeted therapy as well. So how do we decide about that? How do we decide about this personalized approach? So if our for the audience, I would like to tell that once we biopsy the patient, the breast cancer patient, we'll try to look for some molecular alterations and the hormonal status for these patients.
So how do we check that?
So we do it under the biopsy, under the microscope, and we look for ER, PR, and HER2 new status. So those patients who have ER, PR tumor positive, they are very slow growing tumors and they don't progress very fast. But the tumors which are HER2 positive or which are triple negative, that is, all the receptors are negative, then these tumors they progress very fast. And hence the treatment for a HER2 new positive patient can last for a year, while the treatment for hormonal positive patient in the early stages can just last for 3 to 4 months.
The biopsy result decides all this, or we do a separate blood test also for people?
So biopsies are very, very important. Blood test we do to look for the healthiness of the patient, that whether he or she would be able to tolerate the treatment which we are going to give.
So coming to the next treatment part that you said, radiation therapy. What is radiation therapy?
So radiation is just like X-rays, concentrated X-rays being delivered to the breast to sterilize the breast, to sterilize the micrometastasis in the breast. So micrometastasis is the tumor which we are not seen by the eyes, and the concentration of the X-rays with the help of the specific machines, it is done on the breast and the chest wall so that the cancer does not have a local recurrence. So it prevents the local recurrence, and it is not given to all the patients. There are few patients who will receive the radiation and there are few patients who will not receive the radiation. That is why I said that this is a personalized treatment.
Understood. Is there any side effect of the radiation therapy?
So there are few and there are local side effects, but most of the time the side effects they go off after say 10 to 15 days.
That's a great.
Yes.
And what is chemotherapy?
So we divide this into 3 parts: chemotherapy, immunotherapy, targeted therapy, and the hormonal therapy.
Okay.
Not all patients will receive chemotherapy, not all patients will receive targeted therapy. So those patients who have the larger tumor, those patients who have triple negative or HER2 new positive tumors, these are the patients who will receive chemotherapy and the targeted therapy. So I talk about the HER2 new positive tumors. So 20 years ago, so I think 2 decades earlier, there was no treatment available for HER2 new positive breast cancer. And these were the most aggressive subtypes which would recur and patient would lose their life. But now we have plenty of drugs which are targeted against HER2 new positive tumors, and these patients are now living a totally normal life. So this is a very, very personalized treatment nowadays.
Are there side effects of chemotherapies?
So yes, I would not say no. There are certain side effects, but now we are able to manage them in a better manner, because in its nascent phases, once we used to give chemotherapy 2 decades ago and now, there are certain differences which have happened. So we are better able to manage the side effects. The toxicities, they are better managed, and we have plenty of the drugs which we can give, which we can use to manage different side effects. Just for example, the woman would be afraid of chemotherapy because of the nausea and vomiting that happens. And nowadays we have plenty of medicines for nausea and vomiting, such that I have never seen a woman having a very bad nausea or vomiting in previous, say, 2 to 3 years. But they happen, but the symptoms, they are extremely low nowadays.
That's a big hope.
Yes.
Because people fear chemotherapy like anything.
Right.
So you were talking about targeted therapy and immunotherapy. Can you please explain in detail for our audience?
So let's go on to the immunotherapy. So what is immunotherapy? And then we will come to the targeted therapy. What are targeted therapies? So immunotherapy, just think like few of the cells in our immune system that are guarding our whole of the body. And these are basically guarding us from various bacteria, various viruses, and remember also from the cancer as well. So the cells, the immune cells, they kill the cancer cells once they detect it. But what is happening in the cancer? Why the cancer is developing? We have the immune system, but
Yes.
because the immune system becomes lazy and it doesn't detect a cancer cell and it doesn't kill it. So what immunotherapy is really doing, once we are giving the patient immunotherapy, it increases the immune response and it increases the immune cells, and these immune cells and T cells, which are good cells, they supposedly kill this cancer cell. So this is the whole concept of immunotherapy. So God has given us immune system, we are not utilizing it in a good manner. So if we keep our immune system healthy, probably we may not get cancer, right? And what are targeted therapies? So I said that we biopsy the tumor, and once we biopsy the tumor, we see that there are certain receptors on the tumor. So what is a receptor? So you can think it like a antenna on a cell that will receive some signals from the body, and these signals would go to that particular antenna, and then this antenna would transmit those signals to the cell, and then the cell will grow. This is how it works. And if we have something that can block this antenna, that is block this receptor, the signals will not reach the cell, and then the cell will not grow. So this is how the targeted therapy basically works. So as I mentioned, there is a targeted therapy which we call as anti-HER2 new targeted therapy. So HER2 is a receptor on the tumor cell in a breast cancer, which will transmit the signal to the cell to grow. And we now have plenty of HER2 new therapies, directed therapies against HER2 new, that will not let the signal go to the cell. And hence the cancer cell dies because of these targeted therapies. So targeted therapies and immune therapies, they are totally different thing. But and this is how I think I am able to explain how it really works.
So how is immunotherapy and targeted therapy given? Like,
so most of the time they are either IV or oral, depending upon the situation. So there are plenty of them. Few of them are just a oral tablet, and few of them are injectables.
so just a tablet for breast cancer.
Yes, but this is not true for all of them.
But if we detect early, it's curable.
Definitely.
So breast cancer is curable if it is detected on time.
So most of the cancer from top to bottom, they are curable if they are detected early. This is not just true for breast cancer, it is true for all of them. And not just breast cancer, all the cancers. So wherever applicable, the screening should be done. And if the cancer is detected in the early stages, then probably most of them, they get cured.
So I couldn't agree more, because I was very much aware of my body. I was detected with thyroid cancer on time, early, and treated well. And here I am living a perfect life and a normal life.
Yeah, so we have many stories like that. So I remember a lady whom I treated around 10 years back. So at the time, she was around 28. She was a graphic designer. And once we detected her that she had a breast cancer, so it was stage 2 HER2 new breast cancer. So that was an aggressive variant, but it was an early stage breast cancer. And once we declared and we told that that young lady that you are suffering from this disease, so she was just shattered. But she thought that I will take it bravely, and we treated her. The treatment was really brutal. I said, so HER2 new breast cancer, they are aggressive. We treated the patient aggressively. She would come to the daycare, and she just had a jolly nature. She would laugh with the sisters and all. And then she completed the treatment. Because the tumor was small, we did a breast conservation surgery for that patient, and then radiotherapy, and then the targeted therapy. So what happened? She came to me 10 days back, right? There was a little girl with that lady. She was holding the finger of that lady, and the little girl said to me, here is a doctor who saved my mom. So this was really heart touching. And so these are the living examples of the people who fought it bravely, and then they are just not surviving but living. So they are living a healthy and good life.
So that was my next question also. If a woman in her reproductive age gets breast cancer, then can she reproduce?
Yes, so this is pertinent question because the Indian patients they are a bit younger patients. More aggressive variants are there, but if we detect them early, so I told you many of my patients they have now a good family. So
Yeah, just now you
just
gave an
now I
example.
gave an example. So if treated on time, they can become pregnant and they can lead a good normal life.
That's wonderful. If a woman in her reproductive age is, by God forbidden, diagnosed with breast cancer, don't be hopeless. You can still plan your pregnancy after the treatment. Doctor, let's do a rapid fire of some myths that are quite common in the society.
Yes, sure.
Younger women cannot get breast cancer.
No, so as I said, the in India we are seeing younger women. So if younger women have the lump, they should definitely get it diagnosed. So if they get diagnosed, it gets diagnosed early. If they don't, if it is not a cancer, then they get a reassurance.
So people have a notion that I am too young for this. I will not get this. So it's not true.
So it's less common in the younger women, but it can happen.
That's an important point to note. All the younger women should also be self-aware.
Yes.
Next, if there is no family history, we are not going to get breast cancer.
So the 80% 85% of the women, they don't have family history. So the family history means that there is an increased risk of getting breast cancer, but not having a family history doesn't mean that one cannot get the breast cancer. So 1 in 9 women, as I said, can get breast cancer.
So even if you don't have a family history, you can still get breast
The
cancer.
breast cancer.
Another one here is, are all painless lumps not serious?
So specifically breast cancer lumps, they are most of the time painless. And because these lumps are painless, the patients tend to ignore them. So it is not like cancer will always be painful. The painful lump becomes once it gets progressed. So painless lump, if there is a presence of the painless lump, then it should be biopsied and it should definitely be diagnosed.
Next point is, does biopsy spread cancer?
So we do the biopsy with the help of the technique which is core needle biopsy, and these techniques are pretty safe. They don't spread the cancer, and we need the biopsy definitely for treating the patients. It doesn't spread the cancer.
Great, sir. Coming to the last one, sir. If somebody is diagnosed with cancer, they lose all the hope. If a cancer is detected, is there any hope or there's no hope?
No, so once the cancer is detected, definitely it creates a lot of anxiety and lot of questions in the patient mind, whether I will survive or not, what will happen next to my family, what are the finances that will be involved. So it becomes a challenging question. But saying that it comes with the notion that there is no hope is totally wrong. And there are plenty of treatment, and we have plenty of patients around who are now plenty of, in fact, survivors, breast cancer survivors around, which we can find in our vicinity also. So it doesn't mean that it's a death sentence.
Exactly, sir. And you have shared such an inspiring story just now.
Yes.
So if I ask you, there are 4 stages of breast cancer. What is the success rate of each stage?
So as I said that the breast cancer outcomes, they depend on certain things like what is the status of the hormone receptors and whether it is a triple negative breast cancer or whether it is HER2 positive breast cancer. But see, the general rule is that if the person comes in the stage 1, then the survival rates are close to more than 95%. But if the stage goes beyond 1, so if it is stage 2, the survival rates are somewhere around 90%. And if it is stage 3, so it drops down to 70%. And if it is stage 4, even these patients, they can get cured and they can survive for a prolonged period of time. where we find that the 5-year survival is more than 30-40%. So it depends upon the plenty of things, but the general rule that the early detected screen detected patients, they tend to survive for a longer duration and they get generally cured of the disease.
If a person is detected with breast cancers at stage 1, it is 95% cure.
More than 95%. More than 95% cure rates are there. If you detect it at stage 1 and if you detect it at stage 2, so close to 90% patient, they can get cured out of the disease.
That's really a good catch.
Yes.
And with the AI in healthcare, now we have come up with AI thermal imaging for breast cancer. What is it? Can you please explain to our viewers?
So this is a newer thing. So it is not a standard of care, but this is coming up. And this is specially utilized in those areas where we don't have a good equipment and where the mammography is not available. So as of now, this is the utility of that. So what happens? So there is a machine that catches the thermal images of the breast and the thermal heat signatures of the breast. Depending upon the pathology, these thermal signatures can differ, and then the AI would generate a report out of that, which can detect probably the tumor to be a benign or a malignant one. So this has to be then confirmed by the mammography or a biopsy. But this is not a foolproof method. Still, it has a lot of lacunas, and the standard remains the mammography. Probably in some years, we may find that this comes in a big way, but the general thing is that this is mainly utilized in those areas where we don't have the absolute facilities for the screening.
Great, sir. So, as of now, AI thermal imaging cannot replace mammography.
So it can complement, but it cannot replace.
So, as we come towards the end of the conversation, any 3 key messages that you want to give to our viewers?
Be aware of your body, and the self-image is very, very important. So your body speaks to you. So it gives you clear signals. It gives you hint when it needs servicing. So the prevention is very, very important. Don't be just afraid of going to the doctor and doing the preventive screening. Don't just get worried about that. If you develop something which is abnormal, which doesn't look like a normal, then definitely it has to be checked by the doctor. And in some cases, the breast cancer, it is preventable, as we discussed. So leading a healthy lifestyle, decreasing the obesity, improving the physical activity. So these are very, very important. If someone has the breast cancer, just go to the doctor. If you detect it in the early stages, then the survival rates and the cure rates are extremely high. The people don't just survive, they live a full life. So if you have the one, speak to the doctor and take the treatment for that.
Thank you, sir. So today's message is quite clear. Breast health is an important part of a woman's health. Not every lump is a cancer. Not every change is serious. But if there is any unusual or persistent change in your body, you must stay aware. Stay aware of your body, know the signs, understand your screening needs, and if anything unusual happens, seek advice rather than waiting and worrying. Because early detection and timely treatment can make a real difference. Thank you so much, Dr. Manish Sharma, for joining us today and making this important topic understandable in such a clear and practical way.
Thank you. I'm glad I'm here.
Thank you to everyone listening. We hope that today's conversation helped make an important topic a little easier for you to understand. Until next time, stay informed, stay aware, and take care of your health. Thanks for watching. And for more such informative videos, please subscribe to Dr. Circle.